Hello, we have Anna here, and she is already experienced this whole injection thing because she had her nose done recently, and it looks pretty darn good, I think, right? I like it. You like it?
I love it.
Okay, well then there you go. So what we're thinking about doing today is a little bit of filler on her lips. Something conservative, but that'll give her just a little bit of augmentation. Now the architecture of her lips is actually really nice. She's got a really good ratio between the top lip and the bottom lip, where the bottom is a little bit bigger than the top, a little bit more, comes out a little bit more, and has a little bit more volume on the top. So it's kind of like, I like to think of it as 1/3, 2/3, where the bottom is a little more full and also projects a little more. And she has really good definition, and that's really important, is to have really good definition structure. The Cupid's bow, so it's over here, and to the border over here. The vermilion border is very well defined. The Cupid's bow is very well shaped and defined. So I don't need to really do much other than just follow the architecture she already has, just enhance it a little bit, and she'll have a beautiful result. We've already had her with numbing cream on her lips for about, 10 minutes or so?
Mm-hmm.
So for 10 minutes she's had numbing cream on her lips. I'm having her put ice on her lips, and are they pretty numb?
Yes.
Okay, can you feel the ice?
No.
Okay, so that's a big indicator. If she can't feel the ice, and they're pretty numb and ready to go. We use compounded numbing cream that's really pretty strong. So discomfort-wise, it's pretty much under control. The ice is as much for pain as it is to decrease the chances of bruising. Because if we make her lips cold, then the blood vessels contract in, and so if they're smaller, there's less chance for me to hit those blood vessels with the needle as I'm underneath her mucosa. So, and that's the thing, is I can't see what's underneath the skin, and so the smaller those blood vessels are, the less chance I have of hitting them. Okay, open your mouth a little bit, then a little stick over here. Deep breath, deep breath, deep breath. Little stick here. You notice that I'm tapping. Well, I'm not tapping, but Jessica is tapping on the other side. It's a distraction measure that seems to work really well for comfort and to make sure that this is as pleasant as possible, a procedure. Okay, so I have a little bit more volume over here. You can already tell I have more volume here than here. So now what I want to do is add a little bit to the Cupid's bow, to the top of Cupid's bow right there. Enter directly in there. Do that. Okay. I like using needles in the lip because I can be very precise with needles, and I can address just the area I want to address, and then blend and add a little bits where I need to add, and it looks really nice. Okay, open a little bit. Great. I think that's very good. Good, let's go to the other side. Ice over here. You'll notice that go ahead and take that down. You notice that I'm massaging a lot when I do this procedure, and I'm doing that because I can, because these fillers are nice and soft and you can massage them into the shape that you exactly want, and also because I really want everything to be perfectly smooth and really nice for the lips. I'm staying relatively superficial, just underneath the mucosa with my injections. I don't want to go very deep, and I don't want to go into the muscle. I want to stay between the muscle and the mucosa, because deeper are the larger blood vessels that supply the lip, and I don't want to get into those blood vessels. So I want to stay right here, because if you get into those blood vessels, there's a chance of bruising, there's a chance of getting filler into the blood vessel, which you really don't want to do. Okay, turn this way a little bit. Okay. And I'm going to put more into the top lip than I am into the bottom. I think that's nice and smooth. Always right afterwards, for a place like the lip, there's always swelling immediately as soon as you put the needle through the mucosa. And so as long as things feel nice and smooth and it looks good, if there's slight contour irregularities like over here, those generally resolve. Because her top lip was smaller, bottom lip was larger, I don't have to put as much into the bottom lip to make it look really nice. I'm still gonna have a 1/3, 2/3 ratio. Okay, go ahead. Again, same kind of thing. I don't want to go too deep. Just distribute a little bit of product over here. I'm using a hyaluronic acid product called Velour, and I find this to be smooth and it's reversible anytime. I like it quite a bit, and it lasts a good amount of time. I think we can get about a year out of this, and that'll be really nice. Close lips, open. Just trying to make sure that symmetry, smoothness, shape. Cool. I think that's good. Let me see. Yeah, I think that's very nice. And also, this is a little bit swollen. So because we put more into her top lip is going to get a little bit smaller than this. So this is not the actual final result, but I think this should be really nice. As the swelling comes down, I think this should come out really in a really nice ratio and a really nice shape. Okay, so let's take a look.
Oh yes, I like it.
Yeah, I think it looks nice, and it's not too much, right? It's just a little bit, and that's all you need. And the top lip will settle down a little bit. So.
Right. Yeah, I love it. Thank you so much.
All right.